Welcome to Novice Cataract Skills presented by myself, Barton Blackerby. In these videos I show you some tips that will improve your cataract skills as well as identifying correct mistakes that a novice cataract surgeon such as myself will make. Today we'll be focusing on how to manage posterior synechiae. Here we have a patient with around 1 clock hour of posterior synechiae stuck to the lens. These patients can appear challenging, but with a few tricks we can make them a straightforward case. The first thing that I attempt to do is to fill the anterior chamber with viscoelastic. My goal here is to create enough pressure in the anterior chamber that the posterior synechiae spontaneously breaks. Unfortunately, this does not work as most of the viscoelastic remains superior to the synechiae and does not allow it to separate from the lens. My next attempt is to aim ocucoat at the synechiae. Again, I hope that the viscoelastic will accumulate between the iris and the lens and with enough pressure force their separation. Unfortunately, my cannula tip is too far away from the synechiae and I continue to fill the entire anterior chamber with viscoelastic. Finally, it breaks. Not the most efficient way to remove the synechiae, but it worked. At this point, I realized that I should have injected trypan blue prior to my attempts to break the synechiae. As you can see, there is no way to tell if the synechiae pulled the anterior capsule with it and is still exerting traction, or if it actually created a capsular tear itself. I now inject more ocucoat to ensure that the iris is not attached to the lens. This time, I finally developed the correct technique. By injecting viscoelastic with the cannula tip under the iris, I can ensure that the majority of it accumulates between the iris and the lens. I can also sweep across the synechiae to ensure that it is broken. So remember, posterior synechiae can represent a sticky situation, but with the right technique they can be easily managed. Thanks for watching. I hope that some of these tips presented here help you or at least help you identify solutions for problems you may be having during your early cataract career.